Hello and welcome back to our next episode of the Body 101 series. Today we're going to be talking about hip bursitis, and we got that idea from a recommendation and a request that somebody made on our Facebook video. So if you have a request or a recommendation on what we should cover next in terms of the human body, just comment below and we'll make sure to cover it. So we got the request to cover hip bursitis, but from now on I'm going to start referring to it as lateral hip pain or greater trochanteric pain syndrome, and I'll get into explaining that in a minute. But people who have lateral hip pain, it's typically a pain that happens in people over the age of 40, happens when you're laying on your side at night, it's painful, happens if you're sitting with your legs crossed, going upstairs, going for long walks. And the pain, again, is on the outside of the hip, which typically is differentiated from actual hip joint pain. So our hip joint pain happens inside of the groin. So that's where that ball and socket joint is located. So if you're having lateral hip pain, pain on the outside of the hip, the good news is surgery is rarely indicated and it's not something that's wrong with your hip joint. The second thing to consider is that there are a lot of structures that sit on the outside of the hip. There are a lot of muscles that insert into bone right there. There is a bursa that sits there. And then there's other tendons and ligaments that run over the side of this outside of the hip. So what's really important when it comes to getting better from having this pain is figuring out which structure is causing the problem. And they did a study with almost 900 people, and what they found is that less than 20% of those people who had a bunch of imaging done, they found that less than 20% actually had inflammation of their bursa, and most of it was related to tendon injury and a tendinitis and a tendinopathy. And so what that means is that the treatment and the diagnosis and the way you go about getting better is completely different than if it's a bursitis. So the good thing is that here at Point Forward, what we do and what we have exclusively here at our clinic is equipment that helps us determine what is the tissue source of your pain. And so we analyze that through strength testing and tensioning of different tendons, as well as video capture equipment to see which movement strategies and which patterns are you using that are leading to abnormal loading of the structures on the outside of the hip. So through the testing, once we determine which structure is the one that is your primary issue that's causing your pain, that's when you'd have to decide what treatment do I start to seek. So in the past, there's been a lot of different options for people who've had pain on the outside of their hip, one of which would be a cortisone injection or corticosteroid injection. The unfortunate thing about those is although it had provided people with pain relief up to 4 months, they did a study with a lot of people and found that by the time a year came around, none of the people who went through the study had any pain relief just from the corticosteroid injection alone. What they did with other people was give them physical therapy in which they were given regimented and specific exercises that were specific to their movement impairments and their physical impairments. And by the time 15 months came around, over 80% of the people had significant symptom relief and improved function. So we would love to work with you when it comes to your hip pain and your lateral hip pain or greater trochanteric pain syndrome. So give us a call if you want to connect with us. Oh wait, hold on, John. Hold on.
You screwed it up already, didn't you?
I forgot.